With the advent of this COVID epidemic, the online faculties have improved all over the world, be it medicine, be it education, or be it any other corporate meetings which have been carried out all over the world. When it comes to specifically my field, that is the field of medicine, and more importantly, the field of fertility, online consultations have increased by leaps and bounds. A lot of platforms have come up trying to accommodate the patient's difficulties and the doctor's problems together onto one platform and giving them a stage where they could interact with each other without being affected by the disease process per se. There are a lot of benefits when you talk about an online consultation with a doctor. Firstly, of course, the patient needn't go to the doctor. There is no travel time, and both of them could meet on a stage on a pre appointed time and date and exchange the information that is needed to be exchanged. This could also, with the help of certain implements, improve the ways of checking your symptoms. There is a definite say, money saving which is included in the entire process. One could send a e-prescription, but there is an issue with an e-prescription. There wouldn't be a signature on it, or one would have to sign it digitally. The companies do offer privacy and safety of the entire platform. It is very comfortable and convenient because you're sitting at home, you're relaxed, and you could do it at your own time and the environment that you desire to do, or you desire to meet the patient or the doctor. You don't have to go to the doctor. The doctor comes into your living room. The doctor can actually ask you whatever questions that he or she wants and give the appropriate treatment or suggest any other remedial measures that may be deemed necessary. I think this platform is the best when it comes to counseling. When there is not much of symptoms, and this counseling is very important part of our fertility treatments. It could be just patient education per se, or it could be just helping the patient to find correct dates of fertility, correct dates of timed intercourse, or it could be dietary advice, it could be exercise advice, anything which the doctor needs to pass on to the patient without a proper clinical examination can be done on this platform. It absolutely eliminates the risk of any infection that you could pick up from the doctor's clinic or the hospital, or even the infections that you could pick up while traveling from your home to the doctor's clinic or hospital. I mean, all the travel agencies do say that they sanitize their cars, their taxis, but the risk exists, and a definite risk exists because from an individual spread, the disease has now started to spread as far as the community is concerned. These are the pros of online consultation, but every coin has two sides. There are definitely some drawbacks of this online telecommunication that we actually offer to our patients. Firstly, there are regulatory issues. There needs to be a regulation of whatever platform is offered to the patient. A physical examination is absolutely not possible. You could only ask the patient what the thing is, what the symptoms are. And obviously, this is not meant to be done in case of an emergency. In a case of emergency, the patient and the doctor definitely need to meet. Also, it is equipment oriented. The patient should have a compatible equipment in terms of mobile or a laptop or whatever the system is mandated by the platform. A certain degree of net connectivity is also mandated. Otherwise, it really becomes very irritating for both the parties to communicate seamlessly. Privacy, they say, is offered, but the entire concept of doctor patient relationship is based on privacy. Can all the companies say that they are not eavesdropping on the conversation? Well, I doubt it, especially in cases of fertility and even in cases of psychiatric consultations. The privacy will definitely be a big option or a big factor to be catered for. The another thing is possibly the focus. When one goes to a clinic or when a patient is sitting in front of me, my focus is 100% based on the patient. When I'm speaking to a picture from a laptop, my focus is definitely altered a bit. Similarly, the patient, when he's talking to a doctor, the other sibling might come in. There might be some issues in at home which distracts the patient's focus. So there is definite drop in focus of both the sides, both doctors as well as patients. Also, dispensing of medicines might not be as comfortable as it would be. It would one would like it to be. There are certain medicines which I would like to see before actually offering it to the patient. Or else, will a digital signature be valid on certain drugs which are high risk? Normal OTC drugs, there's over the counter drugs, are okay. But when it comes to certain higher medications, will my word of mouth or a e-prescription be valid? The legal standing has to be clarified by the government per se. And what is the legal status of the online consultation also needs to be debated by the community at large. Yes, the examination part is completely ruled out when it comes to digital communication. There are countries which have advanced this online consultation, especially in the West, wherein the patient is given a portable ultrasound and she could do her own ultrasound examination, pass on the findings to the doctor, and the doctor opines based on the ultrasound findings. But I think this is a little far fetched when it comes to India. This process of online consultation definitely has to evolve. And the COVID pandemic, which has affected the world, has definitely started the initial steps towards the evolution of online or telecommunication. Well, we look forward to a lot of improvement to take out a lot of problems that we face at this present point in time. And I'm very, very sure that online consultation is definitely meant to stay. Well, be it COVID which started it, or be it the necessity not to get this disease which started it, it's up to debate. Thank you for a patient hearing.